Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Council President Pro Tem Priscilla Tyson and Chair of those committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. These include Health and Human Services, Finance, and Workforce Development Committees. The goal of the hearing is to promote transparency and provide an opportunity for city residents to learn and speak on legislation that impacts their lives. There will be on occasions when a committee is not covered because legislation is not always scheduled for each committee. The intent of each hearing is to review legislation that will be on City Council's agenda for the following 2 weeks. Tonight we'll hear information on legislation in the Health and Human Services and Finance Committees. The legislation covered will be on the Council's agenda either on April the 4th or April the 11th. The speakers on the agenda for this hearing include the Department of Finance and Management Director Joe Lombardi, the Columbus Public Health Assistant Health Commissioner and Medical Director Dr. Mashika Williams-Roberts, and the Department of Development Special Projects Coordinator Hannah Reed. I will begin with legislation in the Finance Committee by asking Director Lombardi to present. Good evening.
Good evening. Thank you, President Pro Tem Tyson, for the opportunity to discuss ordinances for council consideration in the coming weeks for the Department of Finance and Management. Our first ordinance is 0740-2016, and this is to authorize the Director of Finance and Management to execute any necessary documents as approved by the City Attorney to grant the City of Westerville, Ohio, a standard highway easement for portions of city real property located at Hoover Reservoir in order for the Delaware County Commissioners to complete the Sunbury Road Public Right-of-Way Improvement Project. The city owns real property located near Hoover Reservoir on Sunbury Road, both the Public Utilities Department and Recreation and Parks. And we are granting some easements for Westerville, Ohio to build a bike path and to do some road widening in that area. The city will be reimbursed $7,196 for that, plus this fosters intergovernmental cooperation with other our suburb partners.
Thank you, and I'm excited about the intergovernment-related partnerships that we are, I know, striving to be able to have with our contiguous counties or that around the city of Columbus. So I thank you for that and excited about that partnership. Thank you.
Thank you. The next ordinance is 0850-2016, and the best way to explain this is that the city has a revolving loan fund through the U.S. Department of Housing and Urban Development, HUD, as part of our CDBG program. And the city is allowed to earn interest on those funds up to $500 for administrative costs. The revolving loan fund in 2015 earned interest of $17,061.16. So the city has to reimburse the amount of $16,561.16. We had a shortfall in our 2016 budget by $561.16. So this ordinance authorizes the city auditor to transfer that amount of money to the CDBG fund to add to the $16,000 that was budgeted so that we can reimburse the United States Department of Housing and Urban Development. If there's any questions I can answer for you.
Thank you. And this is the annual appropriation, correct?
Yes, ma'am.
All right. Thank you.
The next ordinance is 0845-2016. This ordinance authorizes the Finance and Management Director to enter into contracts for small tools. This is a citywide contract for various small tools that are used by divisions throughout the city. It is 7 separate contracts. The annual expenditure from those divisions is about $700,000. We are requesting the waiver of competitive bids on this particular ordinance. We are awarding liked items and liked manufacturers to all these 7 suppliers, and the city code at this time does not allow us to do so. We are working on that through a code change, but this will enable our divisions to have multiple choices of suppliers and manufacturers of these small tools. If there's questions, I can answer for you.
No questions on that. Thank you.
The next ordinance is 0859-2016. This is to amend the 2015 capital improvement budget and to transfer funds between projects within the Public Safety Capital Improvement Fund, and to authorize the Finance and Management Director to modify a contract on behalf of the Office of Construction Management with Knight Electric for the installation of emergency generators for various fire stations in the impound lot in a total amount of $6,933. Ordinance 2883-2014 passed in December of 2014, and that authorized the original contract for the installation and replacement of outdated electrical generators for the impound lot and for various, I think there's 5 fire stations. Subsequently, in 2015, we were authorized to modify a contract for the installation of some new gas lines, which were required by Columbia Gas. As we got into that contract, there was other work that needed to be done to replace those gas lines, and this ordinance is requesting the $6,933 that would be needed to complete this project. And these will be for fire stations number 5, number 22, and number 27. These are backup generators in case the electricity goes out. Those fire stations in the impound lot would still be able to function with power on.
Thank you, Director. And so I know that like I said, we passed this in 2014, work was done in 2015, and that we now believe once this $6,933 is, that this should pass council, then we will be done with this project. Is that correct?
That is correct.
All right.
That is correct.
Thank you. And those generators are certainly very important. We want those, we certainly want the impound lot, but more importantly, we also want all of our fire stations to be fully operable, 24 hours a day, 7 days a week. So.
That is correct, and that's what these generators will do.
Thank you.
And our last ordinance is 0899-2016. This authorizes the Finance and Management Director to modify past, present, and future contracts and purchase orders with Universal Fabricating and Construction Services, DBA Unifax Steelworks LLC. Unifax has a citywide contract with the City of Columbus, and due to a reorganization of their company, they were purchased by a company called Turnkey Industrial Services. The company had begun billing city agencies with the new company name. However, they were not aware that you had to go through council to make that change in company name. So this ordinance will allow us to change all their contracts to the new company name, and therefore we would be able to make the payments of the invoices they've already submitted to everyone.
Thank you very much, Director. That concludes your legislation. I would now like to move to Assistant Health Commissioner Dr. Mashika Williams-Roberts for legislation from the Health Department.
Thank you, and good evening, President Pro Tem Tyson. Columbus Public Health has 3 pieces of legislation that we'd like you to consider this evening. The first is ordinance, it's flu zone influenza vaccine ordinance number 0801-2016. This ordinance authorizes the Director of Finance and Management to establish a purchase order with Sanofi Pasteur in the amount of $36,072.62 for the purchase of various flu zone influenza virus vaccines. Each flu season, the immunization program at Columbus Public Health offers flu shots to the residents of Columbus. To ensure having the vaccines that are needed for the upcoming flu season, pre-booking through the manufacturer, which is Sanofi Pasteur, is the most reliable method of ordering these vaccines. Pre-booking also guarantees on-time delivery and 340B program pricing. The pre-booking deadline is on or before March 31st, 2016. Therefore, competitive bidding is being waived in order to secure our reservation to purchase this vaccine. And I should let you know that that dollar amount will allow us to purchase 2,180 doses of the Fluzone vaccine.
Thank you. I know we're talking about the flu already. I know the flu is still going on right now in this community.
Flu is still going on. We actually have not reached peak flu season yet, to the best of our knowledge, but we're monitoring that situation closely.
Thank you.
Thank you. The next ordinance is Flu Mist QIV Ordinance Number 0802-2016. This ordinance authorizes the Director of Finance and Management to establish a purchase order with More Medical, LLC, in the amount of $56,646.95 for the purchase of Flu Mist QIV nasal spray. Again, each flu season, the immunization program at Columbus Public Health offers flu vaccines to the residents of Columbus. It has been determined by Columbus Public Health, or that Columbus Public Health is eligible to purchase Flu Mist Quadrivalent, which is QIV, nasal spray from More Medical, LLC, for the amount stated on the Public Health Entity Agreement, which is the best pricing available in the state of Ohio for this vaccine. Competitive bidding is being waived in order to purchase Flu Mist from More Medical, LLC, at the price stated in the Public Health Entity Agreement. And for this particular vaccine, this dollar amount will allow us to purchase 3,000 doses of the Flu Mist.
Thank you.
Okay, and our third and final legislation this evening is the CNHC Advanced Practice Nurse Services Revenue Contract, which is ordinance number 0803-2016. This ordinance will authorize a modification and a $5,600 increase of a revenue contract with Columbus Neighborhood Health Center Incorporated, doing business as Primary One Health, and extend the time of the revenue contract to May 28th of 2016. Under a revenue contract currently in place, Columbus Neighborhood Health Centers Incorporated, doing business as Primary One Health, will reimburse the Board of Health for the provision of advanced practice nurse services in the amount not to exceed $11,500 for the period of September 21st, 2015 through February 29th, 2016. The Board of Health and Columbus Neighborhood Health Centers Incorporated, also known as CNHC, doing business as Primary One, have collaborated for several years to offer quality advanced practice nurse services.
Okay, so Dr. Roberts, so the 5,600 will increase their revenue contract with Columbus Neighborhood Health Centers, and, well, Primary One, and then under is it a different agreement or the same agreement, then they're going to reimburse the Board of Health?
It's the same agreement. What we do is we share an advanced practice nurse. This is an agreement we've had in place with Primary One for some time now, where previously that nurse was with us for 2 days a week and had been with them for 3 days a week. And we are getting to the point where she will start being with Columbus Public Health full-time for 40 hours a week. So as we go through this transition, that's what this is, just a modification of that contract.
Thank you.
Thank you.
And I'm going to ask you another question just about the previous two ordinances in regards to the flu vaccine. Mm-hmm. Do we ever run out of the vaccine, or do we just get enough for the residents in Columbus?
That's an excellent question, and I'm happy to say after the last probably 5 to 6 years, we have not run out of the vaccine. We've done a really good job of estimating approximately how many doses of the vaccine we need. And these doses that I mentioned here are the vaccines that we're purchasing for what we call our private fund, so those who might not be eligible for vaccine for children or might not be eligible for the vaccines we get from Ohio Department of Health. So those people who are uninsured. These vaccines we purchase for people who are insured. So this is just a portion of what we anticipate giving in the 2016-2017 flu season. We anticipate giving about 12,600 doses of flu vaccine, of which we get a little more, almost 7,000 from Ohio Department of Health, free of charge. So this is what we have to purchase. And we do a really good job of estimating how many individuals we anticipate coming into our clinic, as well as how many we give out in the schools, because as you know, we do go into the schools to provide flu vaccine for our kids as well.
Thank you very much for the presentation on the legislation. And our final presenter tonight will be Ms. Hannah Reed, who will present legislation from the Department of Development.
Thank you, Chair Tyson. Tonight for your consideration, we have one ordinance. We have Ordinance 0818-2016, which is a contract extension for Stonewall Columbus. The original contract was awarded last year for $50,000 towards capital improvements to their kitchen and the facility known as the center's back building. They've been working with the Italian Village Commission to get sign-off on the design of their building, which is why they're asking for the contract extension. This modification would extend the contract termination date from March 31st, 2016 to March 31st, 2017. There's no new funding associated with this legislation, only the modification of the contract dates. I'd be happy to answer any questions.
Thank you. Certainly, we appreciate the work that at Stonewall Columbus, and I know that they're working diligently with the, not the Area Commission, but the organization in the Victorian Village, I think that's who they're working with, or Short North, which one?
The Italian
Village.
Village Commission.
Italian Village Commission to be able to get this issue resolved and compromise on this and move forward so they can continue to rehab their building. So thank you very much for presenting their legislation this evening. I know Carla Rotham wanted to come down, but I think there's some traffic issues, so we appreciate her effort of getting here and appreciate the work of, again, Stonewall. So hopefully my colleagues will be in support of all this legislation, and it will be on either the 4th or the 11th. So I hope this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health and the Development Department, as well as our finance legislation as it supports those ongoing city operations. As a resident, these hearings are really an opportunity for you to learn and become engaged in issues that are presented. The next bi-weekly legislative hearing will be at 4 p.m. on April the 12th. I will also hold a hearing on the capital budget on April the 12th at 5 p.m. This hearing will be an opportunity to review important capital projects that will be funded to maintain and improve our roads, bridges, sewers, parks, buildings, and various infrastructure. Before we conclude tonight's hearing, I want to again thank Joe Lombardi, the Director of Finance and Management. I want to thank our Assistant Health Commissioner and Medical Director, Dr. Mashika Roberts, and also from the Department of Development Special Projects Coordinator, Hannah Reed. Again, my fellow council members and their staffs for all that they do to support the city. And I want to say a special thank you to City Council's Legislative Research Office, especially Michael Kessler, who leads our legislative research team, Andrew Dwyer, and who staffs Health and Human Services and Workforce Development Committees, and then Matt Erickson, who staffs the Finance Committee. And my wonderful staff, Nicole Harper and Carl Williams, and the hardworking team of CTV, and then finally the residents of our city who allow us to do this work on a daily basis. And with that, this hearing is adjourned. Thank you very much. Have a safe trip home.
Thank you.